Dr. Evan Nadler is a surgeon and founder of ProCare Consultants. He's also the former co-director for the Children's Obesity Program at the Children's National Hospital. Doctor, great to see you. This is big news for millions of Americans who do struggle with their weight. Talk to us about GLP-1s and why this is picking up so much momentum as a solution.
Right. So thanks for having me, first of all. And so the GLP-1 medications, which most people will know by their brand names, which are Wegovy and Zepbound. And those medications are the first medications that really have effective weight loss associated with them, which is why the whole revolution started, why there was a supply chain issue, why the compounding pharmacies started getting into the business. And price was a big part of that as well. So this opportunity for people who have Medicare Part D or Medicare Advantage programs, as you guys mentioned, to have a copay of only $50 through those plans is really important for those members who can get access to the drugs, because they are the most effective weight management drugs that we have out there.
Yeah, to be honest about this, I have someone in my family who's been taking these and could not at first because over $1,000 with insurance.
Right. But
then if you aren't on Medicare, this is important because some of the companies are now, if you go directly to their website, they're offering it at $149 a month. So what I think is exciting about this is that we know that so much of our national expenses are paid on things that we could alleviate if people weren't overweight. So this really has the potential to make it a lot better for all of us.
Right. So that's a hugely important point that's not often talked about, which is what does the obesity epidemic cost the average American? Because some estimates are over $1 trillion of our healthcare expenditures are from weight-related disorders. And when we talk about those weight-related disorders, that includes cancer. There are at least a dozen different cancers that are more likely if you have a weight issue than if you don't. So the GLP-1 medications may be even preventative cancer drugs, which is, again, an amazing breakthrough. And again, it could save all of our taxpayer dollars, both federally and state. And getting America healthier is certainly a noble goal, but saving us all a few dollars is also a noble goal.
Yeah, trillion, that's not a few dollars, that's a lot of money.
And a lot of lives, right? A lot of lives are lost. And to your point, according to Penn Medicine, GLP-1 use has now been linked to lower breast cancer incidence in a large cohort study. Is this something that we could see now expand for other uses, other than just reducing obesity?
Sure. And there are other data that suggest that the GLP-1 medications might be useful for alcohol abuse disorder, other addictions, maybe smoking cessation. I think people, although the drugs have been around for maybe even 20 years now, I think 2015 was the first FDA-approved GLP-1 medication, we're still learning a lot about these different medications, and we don't know all their benefits. You know, the cancer data are newer, and there's still studies ongoing to see which of these different indications might be appropriate for future patients.
Yeah, and what's great about this also is that they only had the injection, and now it's pill form as well, which has made it a lot easier for people who had an issue with needles to take this. Dr. Evan Nadler, thank you so much for joining us and helping explain how this works and who all can benefit from it.
Yeah, happy to be here. Happy to talk about it anytime. And one other thing, the pills are cheaper. So that's another big point.
Great.
So that's going to be a big breakthrough as well.
Yeah.
So thanks again, guys. Appreciate it.
Thank you, Doctor.
Well, there is a